I'm so excited today to have Dr. Kaleb Michaud. He is a rheumatology friend of mine who I've known for years online and finally got to meet in person last year. So welcome to the Arthritis Life podcast.
Thank you so much, Cheryl. It's a pleasure to be here.
I'm so happy to have you. And if you could just let the audience know, where do you live and what is your relationship to arthritis?
So I am here in Omaha, Nebraska, United States, in my University of Nebraska Medical Center office, where I am a professor. And my relationship to arthritis is so long. Can I tell you it was my birthday recently?
Oh, yay! Happy
Uh,
birthday.
I just turned the big 50, and which means it'll be coming up 47 years with arthritis. So
Wow.
that's my relationship with it. It's been a lifelong. It's pretty much all I know as
Mhm.
far as personal experience, as well as the main thing I do research here with at the university.
Yeah, that's incredible. Yes, so your relationship you could classify as lifelong relationship to our to
And
arthritis.
and my main profession switched to doing rheumatology research, and I focus primarily on health outcomes and patient registries in many disease areas, but really focused on rheumatoid arthritis, lupus, psoriasis, and psoriatic arthritis. And I pretty much do everything research with people directly or through surveys that aren't clinical trials and aren't like bench microscope complex, that
Mhm.
kind of stuff. So
Yeah. You're really about like how we can improve the quality of life. Would that be right to say? Yeah.
that's
I
right.
love that. As both an RA, rheumatoid arthritis patient, and occupational therapist, that is like what I'm most passionate about as well. And so we're going to delve more into research. So just dangle that in front of everyone. But first, let's start with your personal story. You mentioned you were diagnosed at age 3. How did that happen? And lead me through.
So
Yeah.
I did research on this because when you're 3, you don't remember so much. And I've spent more time with my parents and talking about, now that I'm a parent, get to say, what was it like? What was going on? And got access to my patient notes back in 1977, 1978 as well. And apparently, I was limping. I had a major limp, and they saw I had a swollen right knee. And after so many days of this and crying and not being able to walk, and my mother just had my baby sister who was 1 at this point. So I had to stumble along while she was carrying baby. Uh, I was admitted to the hospital. They did a biopsy on my right knee, and back then, you stayed in the hospital, and I spent a whole month, November through December. I don't know if it included Christmas or not, but it was a long time and very painful, in which I was diagnosed with juvenile rheumatoid arthritis back then, or JRA. And I didn't know what it meant. All I know that it was very painful and that I had trouble walking. And they gave me lots of hot baths and lots of aspirin. So, and I had a big cast on my leg for a while. So that's how it started.
Wow. And yeah, you gave a great talk at the American College of Rheumatology, annual conference last year in 2023, where you had lots of pictures from that time, which were really incredible. But yeah,
Thank
I
you.
usually ask people, what was your emotional response to your diagnosis? But obviously you were 3, so
I I cried a lot. I know that, but I think most of those pictures you saw me smiling because I was getting people to come visit me in the hospital and when they took those pictures. And I think that was really nice to have friends and family come see me. And then I got ice cream cones occasionally. But this continued for many years. And I think I didn't realize that the other health problems I had were all com com completely related to my arthritis. And so, when I was rushed to the ER with a mono infection and almost died, my first experience with an ambulance, um, and I don't know if they knew this either, that was related to having an autoimmune condition. that was not in control. And with my only treatment as aspirin at the time, and taking up to 8 grams of aspirin to the point where I was getting tinnitus, ringing ears, breathing problems. And again, I thought that was arthritis related, but apparently that was a side effect to my pills. So, you know, in and out of wheelchairs, braces on my arms and legs, and having to sleep with them. And, this is what the state of the art in the 70s and the 80s. And then finally getting my first sort of real medicine being gold injections, which were incredibly painful and unclear that did much. It definitely took a heavy toll on me and my family. And I think what happened to me, and emotionally, I think looking back on it, I felt and I was told that I wasn't going to live very long, and that I basically internalized that I wasn't, which is why it's a big deal that I just turned 50. That I wasn't going to live past 26, that I needed to do as much as I could while I could. And, and I grew up in small town Kansas. And I also internalized that I'd done something wrong, to deserve this, sort of I don't know if that's sort of a Protestant upbringing or what, but that I had to figure out and make up for it in some way. And that was part of my spiritual journey at a very young age.
Wow, that's a lot to put on a child, but I think it is common, whether it's from a Protestantism or whether it's from just, I think, basic logic. A lot of times we say, okay, cause and effect. Like we do X, like I bumped my knee on the counter, it hurts. Like I hurt, therefore I must have done something.
Right.
You just apply that logic. And um, I mean, honestly, I often use the example of children getting arthritis to say it's not your fault if you get this autoimmune disease out of nowhere. Everyone wants to think there's a reason so they can have a sense of control over it, or think if I ate better, if I exercised, if I did whatever. I'm like, sometimes your immune system goes rogue and you couldn't have done anything different. And sorry, this is my little pep
And
talk to anyone listening.
I completely agree. And so when people, ask for tidbits of like, what are some of the things I learned? One tidbit, not the current one that I use reference a lot, but was hugely meaningful for me when I was about 12 or 13. Uh, my father would, say TS a lot, when I complain about something, and he would say, well, life's not fair. And, he wasn't the most friendliest individual, but when I internalized that, it was actually completely freeing. The idea that I was not, what I did as a 1 or 2 year old or 3 year old wasn't fair. Like I wasn't being punished for whatever I did at even younger ages, like the idea of an original sin. Like basically life wasn't fair, and bad things happen to good people and so on, and good things happen to bad people. And when I internalized that, I was like, wait a minute, I felt so much more freedom.
Yeah, 100%.
Yeah, I'm like, life isn't fair. You're exactly right. And I was in such a good mood. People were like, you are weird. I'm like, no, you don't understand how much of a burden this is, for me to be like, I've got to be good all the time, to like, I'm kind of like Job. These are the punishments that are going to keep coming, and I have to do the best to show, anyway.
Yeah. No, it's so true. It's very freeing to know that some of it's out of your control. It's scary at first to accept that because control is like the antidote. A sense of control is like the antidote to anxiety, right? So not knowing that you're not fully in control can lead to some anxiety, but it can also be like freeing you from the burden of thinking that you should have just done something different and this would not have happened.
And now that I've had this idea, I'm going to add, I actually got a new rheumatic disease, this summer.
Oh no, you're a collector.
I know, on the way back from Europe for the European EULAR, the day I was leaving Vienna, I was in so much pain I could barely walk. And normally I would have gone to the ER, like something bad is happening, but I've got this very expensive flight back to the US. I don't want to miss it. So
Mhm.
I suffered through it, and I get back and I have acute onset gout.
Oh,
And
not
but
fair.
here's the deal,
Not
like
fair.
I have no risk factors for gout. Like you look at all the things that you're supposed to do to not get gout, that's me. And there's no like having rheumatoid arthritis does not lead to gout. Like it's not anymore, it's like independent. And so for me to get this additional rheumatic disease, I was just like, what, like, I would
Universe,
have, I swore a lot. I
I'm
swore a
so
lot.
sorry. That's
But,
awful.
but life isn't fair and these things happen. And sometimes, I mean, it's just how you respond. It sucked so much, but at the same time, like when somebody else said, "Oh, you've got the disease of kings or queens," like, okay, that's one way to look at it, right? But
Yeah, yeah. That's so rough. That yeah, it reminds me when I got a pilonidal cyst, which is like a cyst on your tailbone. They're like, I'm like this, tiny, like 35-year-old woman at the time, and they're like, yeah, this usually happens to like older, hairy, sedentary, overweight men. And
yeah,
like, we don't
I
know why
don't
you
have any of those things,
you're like,
right?
I'm like, I mean, I have a thick hair. They're like, no, no, we're talking like people who have like back hair, or, like a lot of, and I'm like, okay, yeah, I have no idea. Yeah, it just happened. It just
And
happened.
most of the people who got what I got were girls or young women.
Yes.
And growing up and meeting a support group of young adults with rheumatoid arthritis and similar diseases was so empowering and so impactful, but also a reminder that I was unusual in many ways. Um, yeah.
Yeah. Yeah. And so, yeah, we started with childhood. I'm going to try to be chronological. But what was it like being a teenager with JIA before this? I know we call it JIA now, juvenile idiopathic
Yep.
arthritis. Oh, and you mentioned EULAR, which is the European League Against Rheumatism, or they changed the name now, but that's the
Yeah.
conference in Europe for rheumatology.
Yeah. It's the
Uh,
big one, like
yeah,
14,000 people. So it's good.
I really want to go. I've never been. Anyway, back to you. So, having now,
I
yeah,
was a normal, horrible, all over the place, hormonal teenager.
teenager.
And I think I hit puberty later, so I was even smaller than I should be. I am very thin arms, and that's part of growing up with this. It changes my growth plates. I come from a larger family, and so I know that even though I'm 6 foot tall, I was supposed to be even taller and bigger. And that showed. I think emotional roller coasters were par for the course. And then I think so. One of the things I internalized is that I wasn't going to be a star athlete. I wasn't going to be able to do all the things that, what you grew up wanting to do. I said, well, I'm going to make the most of it. If I'm in a wheelchair most of the time or not, I'm going to just move this brain around and learn as much about how the world works, why it works the way it does, and see how many problems I can help fix along the way. And I was determined to study physics and astrophysics and particle physics and sort of help do that at the most fundamental levels. And that did lead to undergraduate at University of Rochester and graduate school and Stanford, where I got my PhD in physics. But one of the many things that they did with this disease is they said, well, you have to wait till you're an adult. You have to wait till you're an adult until you can start your real drugs. You can wait till you're adult until we can do the surgeries. And I had my wrists replaced. This is an artificial wrist. You can sort of see that that's not attached there. This one was replaced and then they fused it. So I can't actually, like you cannot do that here.
I see. Yeah.
And that happened when I was 23, 24. And I tried to return back to my lab where I was getting my PhD. And the folks were like, you know, this person just tore their ACL and they're back after a couple of weeks. Why can't you be back? I'm like, this is a 6-month rehab process. And it was not a good, support group. So
Yeah.
I took a leave of absence and went back to small town Kansas, in this case, bigger town Kansas, Wichita, to work with my rheumatologist, the one who diagnosed me with JRA when I was 3. He says he needed a statistician, and I was looking for a reason to come back home and have that better support that I needed. And he told me about this data bank called the National Data Bank for Rheumatic Diseases. And in 2001, I joined him as a statistician. And for 2 years, we were just in harmony. He was still seeing patients, but I would be back there coding and doing programs and doing analysis. And he would come in between patients with ideas or singing opera, depending on his mood. And we just had a fantastic time. And I decided, you know what? I want to do this. I'm going to change my research to this, and make a difference in people who have arthritis and apply it to them. People are messy. It's even more complicated than the physics where everything is clean. You've got particles, you control the process, where people have so many things affecting them. And it actually became a great source of joy to know that what I was doing had a more immediate effect on the people around me, people that I was meeting. So I went back and finished my PhD changing fields.
Okay, because I was gonna say I didn't know your PhD was in physics. Okay, so it started out in physics, and then what did it become in?
It stayed physics because
Oh, okay.
in order to switch fields, I'd have to start over for many more
That's
years.
what I thought.
And
Yeah.
so I took a whole bunch of other courses, but I kept the degree in physics. And they basically said, as long as it's heavy enough in the numbers and algorithms, it's okay. Just don't teach physics anywhere.
I see. Okay. So it was more in like such statistics.
And epidemiology. Yeah.
Ah, okay. I love people. I'm sorry. I'm always thinking of episode titles as people are talking. So I'm listening to you, but also part of my brain is thinking about titles. And I'm like, people are messier than particle physics.
Oh,
That's my name.
people are so messy. Like in physics, we pride ourselves in approximating everything so you could get an answer. Like, okay, imagine a horse and a horse. Because you basically make the horse into a sphere, and then you become, interactions. And people, there's so many things that affect our day, like in the last hour, and what you're feeling and how you're processing, and why you make the choices you make. And this is exactly why marketing exists, right? They want to know, and why economics exists. It's the sort of the study of how people behave, and why do they behave that way.
Oh my gosh. Yeah. I find that very fascinating. And so I remember you saying your keynote talk at the conference last year that you had for many years, performing and helping with research in the rheumatology world, but you are not talking publicly about you being a patient too. And that's always that is a common topic that comes up in my like Room to Thrive support groups, and it just comes up in the podcast and people's journeys, deciding when and where to quote unquote kind of come out to borrow language from the gay community, LGBTQ, like when and how and whether to do that in different contexts, whether it's work or home. Yeah. What was your thought process around all that?
So with work, I was surprised because I went to this American College of Rheumatology conference in 2001. And it was a huge conference in San Francisco. And I'm going as a new entry to this whole world and learning so much and really enjoying it. And I'm seeing a few patients there interacting, and they're treated very differently. And I'm seeing this again and again. And then I had one person who was a patient who was there at the conference come up to me and like, so how long have you had it? And I'm like, oh, I was priding myself on having it be invisible. And it kind of upset me because like, damn it, I didn't want people to know that I had arthritis. I didn't want them to be able to tell because I was in my mid-20s and I, single and and then when I told one rheumatologist there, he immediately went into, oh yes, well I can tell now because like, he's examining me and looking through me, and then he completely discounted anything that I was presenting at the poster, and it was more sort of focusing on me and treating me very differently. And this happened, a couple more conferences I went to, and so I basically learned not to say anything and to hide it as much as possible. I also learned to do the same thing dating, because if you bring it up too early, it scares people away. Because like, okay, I don't want to deal with that as well. So that was another unfortunate aspect of being single and trying to,
No, and I think it's amazing how much has changed. I mean, a lot of things have stayed the same too, but I think there's a lot more focus nowadays and on like disability pride and like being able to be, open about things. And I think there's for a long time been more of back in the day, not to say you're old. Huh? I'm 43, I'm turning 43 next month, but
Are
the
you
era,
really? When you
yeah,
said a long time ago, 35, I was like, last year?
yeah, no, no,
Like,
no.
okay.
I'm trying to think. Actually, I think I had Charlie when I was 34. So yeah, that was 36.
Okay.
Whatever. Yeah, yeah. I know. It's the skincare. It's the sunscreen. Being anxious about getting a sunburn has led to me looking younger. uh,
Our, as people with these diseases, have better skin
I think so. I think
in
it's.
general. In general.
I also think I have a little bit of a loose connective tissue, so I
I,
think apparently that helps with
I was
aesthetically.
told that this was a real thing, and it's due, especially, I mean, I've had a lifetime of NSAIDs, and it's related to NSAID use.
Oh,
I was like,
okay. Well,
I did not know that.
this is
So
not medical advice to anyone listening. But with dating, I think I'm wondering if also like you are, a straight male as far as I know, and I think
yep.
there are different expectations on, men than women and so I wonder if that, made you feel different pressures and stuff.
I never liked to hide who I was. And so I revealed this fairly early in dating or conversations, but it was always like knowing that when it was going to come out to see what would happen because, we were like, okay, well, very nice to meet you and have a good life kind of thing. And that would often happen. I mean, I get angry and life's not fair kind of thing, but it is what it is. Like you have every right to not want to have to deal with that in your partner.
Mhm.
And I think for me and others, and this is very much a real thing, if somebody else has the same condition as me, it's even stronger as a repellent. We understand each other very
Oh,
well,
yeah.
but for having kids and the idea of a family, you're like, well, you kind of want somebody else who can be there when you're having a bad day or vice versa. And I mean, I don't know about you, but maybe unconsciously there's this thought that I really don't want to have kids have this issue too.
That's just what's weird about me being a very optimistic person. It literally didn't cross my mind.
I
Because I would say when the time I got pregnant, I was one of those like they were my I had been heavily medicated and successfully medicated for rheumatoid arthritis for the 10 years before after my diagnosis before I got pregnant. I did have one medication fail, quote unquote, after 6 years, and so I had to switch to a new one. But my idea was very simplistic about how I was going to manage my RA. I was just going to keep taking medication. So to me, it was like, right, and we're living in the best era ever for rheumatoid arthritis treatment. So yes, I understand that my child has instead of a 1% lifetime chance of developing RA, they have a 2% chance. Still, it's unlikely, and like it crossed my mind, but it wasn't at all. I think that's weird. I think most people think about it because at least in the support groups and stuff, it's definitely come up. I was just like, that's
yeah.
fine. Like
I mean,
that's just me.
and part of me felt bad because like some of these people who have the other conditions I love dearly and are some of my closest friends. But I think, when I was looking who I was looking for in a partner was probably, yeah. Anyway, so I was more sympathetic to people who were like I didn't want to see me again after I told them. I'm like,
Mhm.
okay, I'm yeah, it's your right and your choice.
Well,
But it's also like one of those things where you can't you can't change it. You couldn't change it. It's kind of like so
yeah,
seeing
but
somebody like who wouldn't date somebody with a certain skin color or certain. I was like, yeah, I mean it's your preference. It's not something I agree with, but it's sort of like I can't.
disability is the only minority group anyone can be part of at any time. So I feel like to me, yeah, uh, I'm not going to put my eggs in a basket or assume that just because someone's able-bodied today, they're going to be able-bodied
Right,
in five
right,
years. Like,
exactly,
I mean, I know,
exactly.
and this has come up a lot with a lot of people who are like, maybe I'm thinking about a couple of people in the support groups where like they were actually the most able-bodied one in their relationship, and they came down with severe, in a case of
Uh,
rheumatoid arthritis after the birth of their third child. And they're like, okay, so I made all these life choices based on this assumption that I'm going to be fine. And then maybe my partner has a chronic illness. And now it's like we're both in this boat and it could just happen to anyone. Right. So,
but that's the investment that you put in your. I mean, see,
yeah.
people break up after that still.
No,
Whereas if I
that's
tell somebody early or like we've been dating for a while, I think it hurts a lot more when there's attachment and
yes.
then having the other person realize like they're not willing to be in it versus early enough where it feels like, okay, I'm not attached. So if they make this decision, like,
That's
okay,
very true. It's not as personal. No, 100%. And you're so right that unfortunately, having a partner with a someone coming down with a disability or having a disabled child is a unfortunate predictor of divorce. But
yeah,
yeah, and but now you are okay. Now I want to follow this thread actually, if that's okay, and then we'll go back to the research. We will
that's
not
fine.
forget. But so how did you meet your wife?
We met at a research conference in Chicago uh, in 2011 at the Medical Decision Making Conference. And I was working with some researchers at Boston and Minnesota, and she was getting her PhD with the group at Minnesota. And
Nice.
I remember meeting her and asking her to join the other groups, and she's like, "No, you go on, that's fine." But she said, "Hey, why don't we talk a little bit more?" Because she wanted to learn more about rheumatology, and they were doing something outside of their normal field with looking at cost effectiveness of the biologics.
Oh,
And so we stayed in touch on that project. And she asked if she could visit Omaha. I said yes, and I gave her the tour. And about 6 months later, we decided to start a relationship. So,
wow. And
and
now
she's
you
now she's a faculty here as well. She does research and trying in the public health, trying to help people prevent them from getting diabetes and prevent help them quit vaping and smoking.
Oh wow. Wow. Okay, those are two tall orders for sure. But that's like critical research. That's amazing that I know with being academics, it's very hard to both get jobs in the same place. So that's
And we're big nerds and we're proud of it. I mean, this is what we do every day. Our kids both have the same initials
oh.
of the medical decision making meeting that we met.
Oh my God, this is amazing. I feel like this is a rom-com
MDM.
in the making. What is
Yep,
it?
yep.
MDM.
MDM. They both have MDM. Yep.
Oh, I love it. I love that. That is so adorable. Um, And I know that people are gonna uh, wonder about, what was it like? A lot of times the people I have on the podcast, for rheumatoid arthritis are more commonly women than men. And just
Yeah.
'cause statistically and also because
They're affected more.
one, I think I'm on social media a lot and a lot of women may potentially are more open with, sharing their stories and stuff there. But what was it like for you when the kids were little? Was it hard, on your joints, on your hands, being able to pick them up or fatigue wise? I mean, it's hard
It
for everyone
was
having babies, like
it
period.
was it
Yeah.
was horrible. But it was kind of I mean, I'm laughing about it now because it's like they're 6 and 8 years old now, which is a huge difference than when they were
Yeah.
born. But uh I I don't do well if I don't get a good night's sleep.
Me
I
too.
flare. I flare and I can't function. Uh, and so being there in the same room and supporting the baby who needed to be fed all night long, we were both miserable and I was useless. And so after a couple of nights of that, like, okay, well, I need to sleep in a different room. I need to get a good night's sleep. And then things were much better. And I basically, I'm a researcher. I talked to lots of other friends who had babies, and a lot of them were not doing very well. And I think a lot of the women were complaining to me that the men were not doing enough around the house, not doing enough to help. They felt that they were more on their own. And so I promised my wife, I said, hey, as long as you are breastfeeding, I will change the diapers. Now, I didn't realize how big of a deal that would be when
So
I
I'm
said it.
laughing just because that's really hard when your hands are hurting. Yeah.
Well, there's that one. And two, what I learned the hard way is that once, especially when they're in daycare, um, they get exposed to a lot of things. And I wash my hands a lot, but I got exposed to a lot of things. So I was getting sick all the time the first couple of years. And so everything they had, I had, it would just be a cycle. And I'm like, this is I've never been sick so much in my entire life. And I didn't stop when she stopped breastfeeding. So I kept on going because I think she just got expect used to me doing that.
Mm-hmm. Mm-hmm.
So like, wait a minute.
Yeah. Oh no. It's
But
It's really hard. It's like one of those things where everyone thinks that they do like 60% of the household labor. Like it's really hard to have that sense of that you're both equally doing
Yeah.
stuff.
And I think one of the stories I talked about last year was before we decided to have kids, my rheumatologist saying, well, you've been on methotrexate for so many years, we're going to have
Yeah.
to go off of it for 6 months and then freeze your sperm, and then you can have babies. And I'm like, what? What? What?
Why did I just freeze them after after being on or after going off methotrexate? They weren't
It has to
okay.
be out of your system long enough because,
Oh,
the old studies showed that it was spermogenic and also caused some other issues. And
okay.
I'm like, I don't think this is true. I think there needs to be some studies on this. And I encourage almost all the studies have been looking at women. And it's a very much known thing that methotrexate it's horrible for babies.
Tetragenic, is that the word? Tetragenic? Yeah.
Tetragenic. I wasn't sure if I should say that, but I mean, and a lot of people lost access to that when Roe versus Wade was removed last year because it's seen as a possible abortive drug
Mm-hmm.
because that's how bad it is
Mm-hmm.
for taking if you're pregnant. So for men, there's a lot of similar assumptions that it would cause bad things, but they hadn't done research on it. They'd only done it in rats in the
Oh,
70s and 60s. And this is where you're being optimistic. I'm looking through and reaching out to all the men that I know who've been on it, and I'm like, okay, everybody seemed to be okay.
okay.
We'll go with it and ignore this advice. And first child, no problems, no issues along the way. And then after she was born, there's first paper published showing that there's no association with bad results with men taking it. So I'm like, I felt redeemed, but it also was a bit of a roll of the dice. And,
Yeah, 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 yeah. Interesting. Yeah, I
so I
think with
went against my rheumatologist's orders.
okay. I know. We all go rogues at some point. Um, and yeah, so you mentioned the importance of research. I do want to loop back because I would love to give you a chance to talk more about the National Data Bank and forward and just what are the types of studies you're doing and how can patients get involved?
So it's called Forward, and we have a website called forwarddatabank.com or forwarddatabank.org. It used to be called the National Data Bank for Rheumatic Diseases. And
Mm-hmm.
I changed the name a few years back because it just wasn't very easy to say.
Yeah.
And the reason we call it Forward is because keeping that optimistic tone, we want to move forward. We send out questionnaires to people with these conditions, and they answer questionnaires twice a year. They're not short, and we have little monthly tidbits that can come out instead. But what happens, and we've been doing this since 1998, we have, over 10, 20,000 people who participate around the US. From these questionnaires, we learn what works and what doesn't. We learned about how bad pain is, how bad fatigue, how bad sleep, the different joints that are affected. Get advice from them, physical function, all of the different treatments. And as I try to tell the fellows here who are getting the rheumatology fellowship here at Nebraska, it is very possible that each of your patients will find a cure that works for them. Our goal is to learn from them and learn because it doesn't always apply and work for the other people around. Like, why
Yeah.
are some things working? Why are some things not working? And it's not just to roll the dice, like some people say. And
Mm.
this is what's been going on for 25 years. And from this, like 600 papers, tons of collaborations. And we provide anonymous data that you provide to researchers around the world. And we try to provide a lot of it back to the participants because it is participant driven.
Yeah.
People who have these conditions go through it, put the time and effort in, and we want to make sure it's useful and valuable for them. But I will tell you, I used to, poo-poo research like this, but the more we get participants to answer these questions, the more we can learn. We've learned so much from it.
Yeah.
I just
Did you
I
poo-poo
can't
it
sing
because
praises enough about it.
was it poo-poo because it wasn't objective enough because it's quote unquote just
Oh
patient
yeah. Oh
perspective?
yeah. I was
Yeah.
definitely drinking I don't, the rheumatologists I work with, they always say, oh, it's got to be joint counts, it's got to be the SED rate or CRP, it's got to be things that we do with the patient. And that is true to a point. But I can also tell you that answering 13 questions is much more predictive of your future than any joint count and blood test. It's unfortunate. I wish it was the other way around. But answer those 13 questions have shown time again to be more valuable to showing your future prognosis than those other things in the clinic.
Well, and I would argue also that tender joint count is also subjective. Like, I mean, I always have a hard time answering that to my doctor because I'm like, well, yeah, it's kind of tender.
Squeeze harder. Like, okay, now it hurts.
Yeah, like it's so I find that anyway. Okay, I'm gonna stop myself from going on a tangent. But the point is that so if you're a lot of people listening, a lot of people in my kind of online community that I've come across, they are looking for not just, it's hilarious that they're looking for like the opposite of what the rheumatologists are looking for sometimes. Okay, obviously we all want our disease to go into remission and to feel no symptoms. That's like goal number one, is to get everything feeling better. But assuming that you're not 100% there, you're like, what can I do? Like, what can I do to reduce my fatigue, to reduce my pain? Just practical everyday tools. And it sounds like that your questionnaires might lead to other researchers being able to tap into that.
Right. Yeah. And it is true that people who participate in research studies like this do live longer and do better in general than those who don't. But, you know, I mentioned this last week with a little bit of tongue in cheek. It's because in some level, people who don't are sometimes doing so poorly that they can't participate.
Yeah.
Or those who choose to do it might be more reflective and might think about how they answer the question as like, you know, I don't think about this very often. Now that I'm thinking about it, I am noticing some things here. I wonder if, you know, addressing that might help these other conditions or help these other areas. And that has been known to happen. And I know that it works for me at some levels. I don't like answering lots of questions all the time, but if I do it every 6 months, I feel like it's sort of like, okay, there's some important things that happen that I can be a little more reflective of. And especially the question about the global, they call it patient global, considering all the ways your condition affects you, rate how you're doing. And there's so many things that are affecting me. Like, how do I put it all in this little 100-point scale? Like,
it's really hard. I mean, as an occupational therapist, everything that well, you do have some objective measures, but a lot of times it comes down to a lot of qualitative, like, you know, making degrees of improvement and not necessarily having these like massive objective numbers like you might see when they first came out with the biologics, where people are like, whoa, I went from like every joint hurting to none of the joints, you know. And I'm looking at the research library on the website right now, and like, for example, just to give a couple examples, there's like the publications that have come from this research, you know, or the data bank is like the impact of menopause on functional status in women with rheumatoid arthritis. That has been coming up a lot.
That's a big one. And it really sort of drew back the question of, I'm sorry to cut you off there.
No, please. No, I was going to ask you more about that.
Should we be revisiting getting hormone replacement therapy with women with rheumatoid arthritis going through menopause? And some people, I mean, because we're finding, even though there was reasons for it not to have it, but the huge impact of your hormones on your disease activity. And, you know, what is the best approach there? Because, you know, we as a group of patients in general have been punished in the past by the cardiologist who took away some very good therapies because they caused heart attacks in people who did not have any inflammation. But they were actually really good for those of us who did have inflammation.
Oh, I didn't know that. Yeah.
Oh, okay. I'm speaking about Vioxx back in the day. And that was great for people with RA and inflammatory conditions. But if you were OA only, it was definitely increasing your heart attack risk. But anyway, I think hormone replacement therapy is one of those similar things where overall it slightly increased the risk for cardiovascular events. But they rarely look at the subclass of people with RA and inflammatory conditions like this.
Interesting. Yeah. I mean,
Anyway, there's more research to come out of that soon. That's
no,
one of many.
I was just linking that in the show notes if people want to learn more. But yeah, what are some of your favorite like current like publications or historical things that have come
I'm
out of this?
currently looking at cannabis use. More and more people are feeling comfortable talking about what they've been trying, what's working, what's not. And I'm very excited about what the future holds there, even though it does feel like we're still in the Wild West and we're far away from,
Mhm.
where it will be as a source of pain relief, not necessarily disease activity relief. But if you can help
Wow.
control some of the pain, because some of the pain we have is not going away once our disease is under control. And it's very
Yeah.
frustrating. As
Yeah.
somebody who's sort of low disease activity, I can be in a lot of pain from what has basically become like OA and other issues that have just come from a lifetime of RA.
Now, when you say, how do you measure disease activity when you're
Uh,
saying,
from forward, we do it primarily through the PASS-2, or sometimes people call Rapid 3 tool. It's the global, like considering
yeah,
all the ways you're doing, the pain and physical function, and
okay,
averaging those together.
yeah.
And that
Oh, it's
works
just,
for people with all conditions, not just rheumatoid arthritis.
yeah, yeah. Okay, that's helpful. No, I think I remember you presented a few times on cannabis in the last or maybe it was the last couple conferences, they all start blending together. But it is something that people ask me a lot about, and I still feel a little like I'm definitely not an expert in cannabis for pain by any means. So I'm like, there's starting to be more um access to like nurse educators that have like special training in cannabis and stuff like that. But certainly the patients seem to, so many use it as an important tool in their pain toolbox.
Yeah, and I'm not a proponent either way. All I know is the US seems to be far behind other countries because of
Mm,
the legal status. Um,
interesting. Yeah, yeah,
and
yeah.
what I hear from patients and people, especially people in other countries, is that it's titrating the right dose of CBD and THC on the individual level. It's like pure personalized medicine
Mm.
to help people really control their pain from whatever the reasons and subsequent anxiety that comes from it. So,
Yeah, I love the fact that it can work on both. Like, yeah, it can help some people, CBD or CBN or whatever, there's such complexity to it, but some people use it for sleep, some people use it for anxiety, some use
yeah.
it for pain. And so yeah, it's great that again, like, oftentimes I'll hear patients say stuff like, um, well, okay, well, this is opening the can of worms of like diet, but sometimes they'll be like, I'll say, well, the research is really clear, like that, medications have the, you know, best likelihood of putting your disease in remission. They'll say something like, well, it's because like there's a lot of money in pharmaceuticals, but there's not a lot of money in like diet, which
Oh, oh, I wish it was the other. Yeah. So, first of all,
feel free to get on any
some of
soapbox
the
you want
best
to.
DMARDs
Yeah.
that like methotrexate and hydroxychloroquine and other ones aren't promoted, even though they work so well because there's not big money behind them. So that statement is true. There's a huge difference between a new drug that's on patent and what you'll get pushed versus an older one that's been around that getting new science on. One. Two, there's actually a ton of money when it comes to nutrition and dietary products, and they're not under nearly the same amount of restrictions in what they can advertise and see. And I've been to other countries and you see this very unusual where you watch TV and you have commercials that look very expensive, nicely produced for supplements. And they're showing these supplements as curing them of everything. And
Oh,
you know
wow.
that's not true, but you can't tell. But that country has different rules where they're allowed to do that for supplements. And you can do that here as well, but they're not allowed to promote any prescription medicines, which is what they do in the US, which is unlike other countries.
I didn't know that they were able. I thought the countries that didn't allow promotion of or commercials for pharmaceuticals also didn't allow promotion for
There's a
supplements.
mixture of that too, but overall, you see so many more things that are basically supplements that look like they are the best thing. And the
Mhm.
doctors are constantly fighting against this because there's so much more money in the supplement side of things.
That is okay. Yeah, I need to do a whole episode on this because it's
Agreed.
really fascinating from a psychological perspective. the natural is better logical fallacy really seems to be very tough for people to overcome.
And I totally get that. I felt that way in many ways, but I had to experience it firsthand. Like I had all of my childhood and young adult life, and then finally I'm turning 2021 and I finally go on methotrexate, and it was like a whole new world. Whole new world.
Well, I feel like if I were, and I asked this to Lena Anderson too. So this was like a couple of years ago when I had her on the podcast. But I feel like if I were you or her who had, experienced much more severe joint issues from their condition than I have, because I was put so early, fast, aggressive onto the biologics plus methotrexate. But I feel like I would be bitter towards the people who choose not to take the medications. Like, you don't understand. Like, I don't know. Maybe you're a better
I mean,
person than
everybody
me.
gets to have their feeling. I had a very close friend who was diagnosed with lupus, and she said, I'm going to beat this with holistic approach, only natural ingredients, natural diet. And, I'm like, power to you. I'm happy for you, but I'm pretty sure you should take hydroxychloroquine. It's like, nope, I'm not going to take that poison. 2-3 years later, she had a flare, was in the ER. And after switching lots of rheumatologists to try to find someone who would, help her do the way she wanted to. And she was on hydroxychloroquine and prednisone. And she's like, I was so naive. Like, this is so much better for me. And I almost died because of it. And, I'm glad she's okay. And she's actually gotten a lot better with another therapy since then. But it's unfortunate that she had to suffer and go through that to figure that out, because people like want to experience it at some level.
It is really tough. And I don't mean to be flippant about people who
Yeah.
make the choice not to. It is, for me, it is all about whether or not that choice is informed. If you have all the information accurately in front of you that's not biased and you choose not to medicate, that is totally fine. I respect that. And that's obviously not my choice. It's your life. But I think what kills me is seeing people who think they're informed, but they're actually been informed by bias information.
Get evidence. Get evidence. That's right.
That's why we need research.
That's right. That's right. I can't. Yeah. And the
I mean,
people who do research and read the research are going to be your better physicians for you as well, because they're going to be a little bit more on top of why it is better and not just doing what they're told.
that's so true. Well, okay, and I'm trying to be mindful of time now.
We should totally talk again, because I
yeah,
think
we definitely should. Yeah, yes, this is just part one. But what are some of your favorite self-management tools, today that you use?
So I think by far the most important one is, how do you get a good night's sleep?
Yeah.
I mean, I think that is so important. So one of the ways I ended up doing is, again, I don't fit the bill for this at all, but I found out complaint from friends and partners that I snored.
Yeah.
So I did a sleep study, and it was a horrible experience at the time. But I was diagnosed with chronic obstructions, sleep apnea, obstructive sleep apnea, OSA, and got a CPAP machine, and I hated it and I refused it, and I sort of fought with it for a couple of years. But when I found something that finally worked, has been revolutionary for me. And that question about how much time in the morning when you wake up are you stiff and sore? Like, not at all.
Wow.
That was for me. But that was huge for me, because I got a different bed, different pillows, different routine. Definitely no caffeine after 4 o'clock. Really watch your alcohol consumption, because alcohol affects your sleep quite a bit too. But in the end, that was the biggest contributing factor for improving my sleep and overall health. Was that.
It helps my mood so much too. Sorry.
Yeah.
Mood
And then the other thing for me, because I've got torn meniscus and OA in the knees over my life, and my feet have been reconstructed and all that kind of stuff. Getting good shoes and good orthotics, something I still am struggling with a little bit. But I'm also trying to postpone knee replacement until I was in my 50s. So I guess I can start thinking about that.
Oh no. Yeah. Understandable. Yeah. We become shoe connoisseurs for sure.
Getting good chair. I mean, depending on what you do, I have a wrist brace that I take with me just in case I need it. Things start to get painful. Because once the pain starts, it usually is a sign of it's really going to get bad soon.
Mm-hmm.
Um,
Mm-hmm.
I sort of watch my weight. That's also sort of, I know that everything is worse when you're overweight, but also my body, my knees especially, tend to be very sensitive to how much weight I'm carrying.
Mm-hmm.
So where carrying a heavy backpack, like I've
Yeah.
had a little bit of back pain this week, and I'm like, wonder what happened. I'm like, oh yeah, I don't need that heavy computer, right?
Mm-hmm.
Things like
Mm-hmm.
that. Just sort of listening to yourself, like where is it coming from? What's working? What's not?
I really think that patients that live with these conditions after a while should have like an honorary occupational therapy degree because you really do become like so well versed in ergonomics just through your own pain. Yeah. Yeah.
My
Oh, with the same
mouse, the
mouse, I
sideways
think.
mouse, I love
Yeah.
it. This is a Logitech, but it's
Nice.
basically sideways, so I don't have to, and I have an ergonomic split keyboard that's worked for a while. I
Yeah.
prefer if I had keyboards just hanging down by the side of my chair, but they don't make, or at least not handy. I
Yeah.
think also for me, I do a little latte cappuccino in the morning.
Mm-hmm.
And people are like, why are you mentioning this as part of your self-management? It's like, it really is amazing what it does for my pain levels in the morning.
Hmm.
Um, and I've learned from neurologically that it's better to get it 2 hours after you wake up, so your brain can wake you
Oh,
up first instead of
okay.
being, so you don't create a dependence on it.
Mm-hmm.
And then I find that I'm really good for the day, and I occasionally I need something in the afternoon, early afternoon for like tea or something. But yeah,
I also think maybe just I mentally potentially that can be like you're almost like a self-care. Like I'm having this delicious, cappuccino. Potentially for me at least. I'm a
I
creature of routine, so I
I
like.
never drank it until we had kids though. So
I was so stubborn. I was like, I'm never gonna drink coffee. I know I'm never gonna be one of those people. And then for me, it was grad school. And grad school, I was like, okay, I'm doing this. This has to happen.
yeah, grad school, you're like, hey, we were diagnosing you with a twitch. It's
Yeah.
related to caffeine and stress. So you need to reduce your caffeine and stress. I'm like, I got my dissertation in 6 weeks. What am
Yeah,
I
you're
gonna
like,
do?
no.
Like,
Maybe talk to me in 6 weeks. Yeah.
exactly, exactly.
Okay, so for rapid fire, rapid fire questions, do you have any best words of wisdom for newly diagnosed patients?
Uh, talk with, I mean, get a good rheumatologist. I mean, they probably diagnose you, but make sure you've been diagnosed by a good rheumatologist and find a good fit for you, hopefully nearby if possible. And reach out. I get reached out by a lot of friends who have friends or family members who were recently diagnosed. And, you know, listen to others who've gone through it. Grain of salt, some things are going to apply, some things won't, but be open and be open to the idea that things will change, but they don't always necessarily have to change dramatically. Because there's horror stories
Yeah,
that you hear about because those carry, but the ones that where people are doing pretty good, you may not hear about as much as well.
100,
And
100.
try to, if possible, attitude is everything in my mind. Try to find some support and reasons to have a good positive attitude, even if things feel horrible and down.
Yeah, yeah, 100%. I was gonna say 1,000%, but I was like, I can't say that. Just somebody who does statistics. Um, do you
Point
have a favorite?
taken.
Yeah. Do you have a favorite book or movie or show you've watched recently?
Oh, I
Assuming.
used to do a weekly movie night. Oh, there's so many. Um, I, I, I've been listening to a song on
Okay.
repeat quite a bit by uh, Glass Animals called Water, because it
Okay.
combines sort of my love of sci-fi with sort of synth pop. And that has been
Hmm.
very catchy, and the kids have been enjoying it quite a bit too. Um,
Love it.
I was a big fan of Andor, the Star Wars
Oh my,
show.
I love that. So good. Sorry, shout in the
I
microphone.
can't wait until season two, the final season comes out. But I thought that was sort of, as a Star Wars fan, it's just fantastic.
And
So
I didn't even know all the lore of Star Wars. I just think the main actor, Mandor, of course I'm forgetting his name. He's so captivating. I will watch him in anything. Like,
Yeah, Cassian is.
yes.
And then I mean, my favorite movie of the year, without a doubt, is Dune Part Two in the
Mm-hmm.
IMAX and
Being a
possible.
theme, yeah.
And I still listen to a couple songs from the soundtrack, and my kids like, "Is this Dune?" And like
Yeah.
before it cuts to the end to the credits, some of the sounds and the sort of Mediterranean, North African theme music that Hans Zimmer brings into it. It's just it gets so emotional. And the theme of that, knowing that here's somebody who's not necessarily a good guy, he knows that what the decision he's making is going to be bad for a lot of people, but also feels like he's obligated to do so. So I really enjoyed
Uh,
all of that. So
so good. When you said your song in your head, I thought you were going to say Sabrina Carpenter Espresso.
don't put it in my head.
Because
Don't
you
put it in my
mentioned
head.
cappuccino. Sorry. Her album's really good though. It came out last week. Okay.
My daughter's a Swiftie, so I get plenty of those
Oh,
things in there too.
you know that I went to both nights
Oh
in
yeah.
Seattle, right?
Oh
Yeah,
yeah.
yeah, okay. Um, this is why I didn't tell you about beforehand, but just because I know that you love board games. Do you have a favorite board game? Or is it
I
too hard to
do.
think?
I
Okay.
do. Currently it is Castles of Burgundy, by Stefan Feld, is a German. They have a special edition version of this, and it's just so beautiful. The components are so nice. It's such a good thinky board game, and it just passed Terraforming Mars as my new favorite, but otherwise it was
Oh,
Terraforming Mars. So
okay. Terraforming Mars is on my list. I don't
yeah.
have it, but awesome. I love it. That's so great. Do you know the game Ascension?
Oh yeah, the card
Yeah.
game,
Yeah, the
the
card
deck
game.
builder.
Yeah.
Yeah, yeah, I play it every day. There's two friends on my iPad. We
Oh,
just
you have
do
that.
two
That's
turns and
so
we're done.
funny. That's what we did on the air. Our family went to Japan this summer and we played it on the airplane a lot. It's so
My
fun.
kids are constantly like, "Oh, this person's winning." I'm like, don't be so sure. I have some good."
Yeah, no, you never know till the end. Yeah. Oh,
That's
that's so
right.
fun.
Yeah, yeah.
Okay. So last one. This is a hard one, but what does it mean to you to live a good life and thrive with rheumatic disease?
Uh, it, I'll tell you what it doesn't mean.
Okay.
It doesn't mean you don't suffer. It doesn't mean you won't have horrible days. It doesn't mean everything's going to be great. Uh, but in my mind, for me, I made a decision many years ago that I'm going to live a life of purpose. And my purpose is to help make those people's around me, their lives better, people with these diseases, their lives better. And I get up every morning knowing that this is part of my purpose and that I want to say, in a few years or if something happens to me and I'm gone, that Kaleb Michaud helped patients with these diseases get better and learn more and do better. And then, you know, the other side of it is I want to make sure that people are finding board games and finding things that they can be passionate about, whatever it might be, to enjoy those days that we do have.
Wow, that is gentle arthritis friendly claps. I'm giving you gentle arthritis claps. That was mic
I
drop.
could never slap. I mean, I
Yeah.
could never
Naps.
snap. I
I
had
know.
to clap
You're like,
instead.
oh, I know. Barely functionally able to snap. No, that was beautiful. Yeah. Wow. I'm just gonna leave it there. Let that percolate. Where can people find you online?
I'm on X at Dr._K. I was an early adopter. And on LinkedIn, and then forwarddatabank.org and forwarddatabank.com. And then you can find my name. I'm listed lots of places too.
Yes, and for those who maybe aren't in the know, X is the new name of Twitter, formerly Twitter. And I've noticed a lot of researcher and academic kind of engagement there, patients as well. But the patient community I've connected with more frequently is on like Instagram, but I don't think you have an Instagram. But
Yeah, I run a board game cafe on Instagram, and that sort of separates the two for
I
me.
was,
So
yeah, that's a good idea. That's why have a separation between work and life. I don't do that myself, but I recommend it for
aha.
others. Well, thank you so much. Again, we have more to talk about in the future, I'm sure. And it's been just totally a pleasure
Truly a
chatting with
pleasure.
you.
Yes, Cheryl. Thank
Yeah.
you. And I look forward to chatting again sometime in the future.
Yes, you too. Okay, bye bye for now.
Have a great weekend.
You too.